What are the complications of myositis? Myositis, a group of autoimmune muscle diseases, can lead to various complications, some of which can significantly affect a person's health and quality of life. The specific complications can vary depending on the type and severity of myositis and individual factors. Here are some of the potential complications associated with myositis. 1. Muscle weakness and atrophy. Persistent muscle weakness is a hallmark of myositis. Over time, muscle weakness can lead to reduced mobility, difficulty performing daily activities, and muscle atrophy, muscle wasting. 2. Contractures. Prolonged muscle weakness and inactivity can lead to joint contractures, which are permanent or semi-permanent tightening of the joints. Contractures can limit joint movement and flexibility. 3. Respiratory complications. In severe cases of myositis, particularly in inclusion body myositis, IBM, respiratory muscles may become weakened, leading to breathing difficulties. This can result in the need for respiratory support and increased risk of respiratory infections. 4. Dysphagia. Difficulty swallowing. Dysphagia can occur in some cases of myositis, affecting a person's ability to eat and drink safely. This can lead to malnutrition and aspiration pneumonia. 5. Skin and dermatological issues. Dermatomyositis, a subtype of myositis, is characterized by skin rashes. These rashes can sometimes be disfiguring and may require dermatological management. 6. Joint pain. Some individuals with myositis experience joint pain and inflammation, which can be similar to arthritis. Joint involvement can lead to reduced joint mobility and discomfort. 7. Cardiac involvement. Certain types of myositis, such as myocarditis, inflammation of the heart muscle, can affect the heart and lead to heart-related complications. 8. Gastrointestinal issues. Myositis-related inflammation may affect the gastrointestinal system, causing symptoms such as abdominal pain, diarrhea, or constipation. 9. Calcium deposits. Calcium deposits can sometimes accumulate in the affected muscle tissue, leading to calcinosis. Calcinosis can cause discomfort and affect joint function. 10. Systemic complications. Myositis is considered a systemic autoimmune disease, meaning it can affect multiple organs and systems in the body. This may include the lungs, kidneys, and other organs, potentially leading to complications specific to those systems. 11. Psychosocial impact. The chronic nature of myositis and its impact on physical function can lead to psychosocial challenges, including depression, anxiety, and reduced quality of life. Support from mental health professionals may be necessary. 12. Medication side effects. Some medications used to treat myositis, particularly immunosuppressive drugs, can have side effects, including increased susceptibility to infections and potential organ toxicity. Careful monitoring and management of medication side effects are essential. 13. Cancer risk. Dermatomyositis, in particular, is associated with an increased risk of certain cancers. Regular cancer screening may be recommended for individuals with dermatomyositis. It's important to note that not all individuals with myositis will experience these complications, and the severity and impact of complications can vary widely. What is rhabdomyolysis resulting from myositis? Rhabdomyolysis is a rare but serious complication that can result from myositis. Rhabdomyolysis is a condition in which muscle fibers break down rapidly and release their contents, including a protein called myoglobin, into the bloodstream. Myoglobin can be harmful to the kidneys when it accumulates in large quantities, potentially leading to kidney damage or failure. Here's how rhabdomyolysis can be related to myositis. Muscle inflammation and damage. In myositis, there is inflammation and damage to muscle tissue due to the autoimmune response. This muscle damage can lead to the release of muscle cell contents, including myoglobin, into the bloodstream. Increased risk of rhabdomyolysis. Individuals with myositis, especially those with active and severe disease, may be at an increased risk of developing rhabdomyolysis because of ongoing muscle inflammation and damage. Symptoms. Rhabdomyolysis can cause symptoms such as severe muscle pain, weakness, dark urine, often reddish or brownish in color, and generalized weakness. These symptoms can overlap with the symptoms of myositis. Complications: the release of myoglobin into the bloodstream can lead to kidney injury, as the kidneys have to filter and process the excess myoglobin. Severe rhabdomyolysis can result in acute kidney injury, which may require hospitalization and medical intervention. It's important to recognize the signs and symptoms of rhabdomyolysis, especially in individuals with myositis, as early intervention is crucial to prevent kidney damage and other complications. If you suspect rhabdomyolysis or experience symptoms such as severe muscle pain and dark urine while living with myositis, you should seek immediate medical attention. Treatment for rhabdomyolysis may include intravenous fluids to help flush out myoglobin from the kidneys, monitoring kidney function, and addressing the underlying cause, which in this case would be the myositis. Managing the underlying myositis through appropriate medications and therapies is essential to prevent further muscle damage and reduce the risk of recurrent rhabdomyolysis. Regular monitoring of muscle enzymes, such as creatine kinase levels, and kidney function can help. Healthcare providers detect rhabdomyolysis early and take appropriate measures to manage it. It's crucial for individuals with myositis to work closely with their healthcare team and promptly report any concerning symptoms to ensure their condition is well managed and potential complications like rhabdomyolysis are addressed in a timely manner. What is the usual duration of myositis? The duration of myositis can vary widely from person to person and depends on several factors, including the specific type of myositis, the effectiveness of treatment, and individual variations in disease progression. Myositis is generally considered a chronic condition, meaning it typically persists for an extended period, but the course of the disease can be highly variable. Here are some key points regarding the duration of myositis. 1. Chronic nature. Myositis is often considered a chronic autoimmune disorder, which means it can last for many years or even a person's lifetime. Some individuals may experience long-term symptoms and require ongoing management. 2. Fluctuating course. Myositis can have a fluctuating course, with periods of disease activity, flare-ups, and periods of remission where symptoms improve or temporarily resolve. Flare-ups can be triggered by various factors, including infections, stress, or medication adjustments. 3. Response to treatment. The duration and course of myositis can be influenced by the response to treatment. Early diagnosis and appropriate treatment with immunosuppressive medications can help control inflammation, reduce symptoms, and potentially extend periods of remission. 4. Type of myositis. The specific type of myositis can affect the disease's duration and progression. For example, inclusion body myositis, IBM, tends to be a progressive and slowly evolving form of myositis, while some cases of dermatomyositis and polymyositis may respond well to treatment. 5. Individual variability. Myositis can affect individuals differently. Some people may have mild, manageable symptoms, while others may experience more severe and persistent symptoms. 6. Age of onset. The age at which myositis begins can also influence its course. Some forms of myositis, such as juvenile dermatomyositis, primarily affect children and adolescents, while others are more common in adults, especially older adults. 7. Management and follow-up. Consistent medical management, physical therapy, and ongoing follow-up with healthcare providers are essential for controlling myositis and monitoring for potential complications or relapses. It's important to emphasize that while myositis is generally considered a chronic condition, the course of the disease is highly individualized. Some individuals may achieve long-term remission with appropriate treatment, while others may experience more persistent symptoms. Regular communication with healthcare providers is crucial to adjust treatment plans as needed and optimize the management of myositis. Additionally, research into myositis continues, and new treatments and therapies may offer improved outcomes for those living with this condition. Can myositis be fatal? Myositis itself is generally not considered a fatal condition. However, it's important to understand that myositis can lead to complications that, in some cases, can be life-threatening. The severity of these complications and the risk of fatality can vary depending on factors such as the specific type of myositis, the extent of muscle and organ involvement, and how well the condition is managed. Here are some potential complications associated with myositis that may pose a risk to health. 1. Respiratory complications. Severe muscle weakness, especially in respiratory muscles, can lead to breathing difficulties. In advanced cases, respiratory muscle weakness can result in respiratory failure, which requires immediate medical intervention. Inclusion body myositis, IBM, is known for its association with respiratory issues. 2. Aspiration pneumonia, dysphagia, difficulty swallowing, can occur in some individuals with myositis, increasing the risk of aspirating, inhaling, food or fluids into the lungs, which can lead to pneumonia. 3. Heart involvement. Some forms of myositis, such as myocarditis, inflammation of the heart muscle, can affect the heart and may result in cardiac complications. 4. Kidney injury. Rhabdomyolysis, a condition in which muscle breakdown products are released into the bloodstream, can lead to acute kidney injury in severe cases. 5. Infections. Immunosuppressive medications used to treat myositis can weaken the immune system's ability to fight infections. This can increase the risk of infections, some of which may be serious. 6. Cancer risk. Dermatomyositis, in particular, is associated with an increased risk of certain cancers, which can be life-threatening if not detected and treated early. 7. Medication side effects. Some medications used to treat myositis, particularly long-term use of immunosuppressive drugs, can have potential side effects that may affect various organs or systems in the body. It's crucial to note that with appropriate medical management, including medication, physical therapy, and regular monitoring, many individuals with myositis can effectively control their condition and reduce the risk of complications. Early diagnosis and treatment play a significant role in achieving better outcomes and minimizing the potential for life-threatening complications. Individuals with myositis should work closely with their healthcare providers, including rheumatologists and neuromuscular specialists, to develop and follow a personalized treatment plan, and undergo regular monitoring to address any emerging issues promptly. While myositis may pose certain health risks, with proper care, many individuals can lead fulfilling lives and manage their condition effectively.